from the virtual studios of the Department of Communication in Phillipsburg. Health, Social Development and Labor's second panel discussion on the COVID-19 vaccination update. Your host, Relica Roach.
Social Development and Labor, the Honorable Omar Otley, Prevention Services, Dr. Anand Raghu Singh, General Practitioner, Professor Dr. Red Cross Blood Bank Foundation, Ms. Claudette Reif, a quality nurse at the White and Yellow Cross Care Foundation, St. Martin. Online viewers and radio listeners via St. Martin Gov Radio 107.9 FM and respective radio stations island-wide. Communication, and on behalf of the government of St. Martin, I welcome you to the second virtual panel discussion to provide the public with updated information regarding the COVID-19 vaccination on St. Martin. To open up the discussion, I would like Social Development and Labor, the Honorable Omar Otley, to address you. Minister Otley, you have the floor.
Thank you, Relica. A pleasant good evening to my honorable staff. A pleasant good evening to all the viewing and listening public. Discussion, COVID-19 vaccination, especially as the Minister of Public Health, Social Development and Labor, and as the Minister endorsing the drive to a great initiative by all stakeholders involved, and I am interested to of St. Martin or wherever they may be from. Thank you.
Thank you, Minister Otley, for opening up this panel discussion this evening. At this time, I would like to invite Department Head of the Collective Prevention Service, Mrs. Lycida Weaver, you have the floor.
Great, thank you, Relica. Is the presentation going to be loaded? Okay, I will try to share my screen on my end, sorry. Oh, okay. Great. Hopefully everyone can see what is presented in front of them. But I wanted to thank the viewers and joining via Facebook Live and listening to live and radio. As a member of the vaccination management team, I am pleased to provide the public with an update on our COVID-19 vaccination campaign thus far. So if we can advance to the second slide, please. So since we've started administering the vaccine, with our first recipient being on the panel this evening, Nurse Claudette, there have been just under 15,000 persons who have received their first dose. And when we look at our population figures, this comprises about approximately 29% of our eligible adult population. We have recorded just over 10,000 persons who have been fully vaccinated, or about 1 in 5 persons of our eligible population who have been fully vaccinated. I want to commend those persons who have already taken the vaccine. Needless to say, we are well on our way. However, we still have a ways to go. I want to encourage persons who are particularly in the high-risk groups to come forward and get vaccinated. So this chart shows the total number of first doses that have been given over time, which started back in February. And what we've achieved to date has been great. However, when we look at it over time, the demand has been steady, but recently it seems that demand has been slowing down, which is indicated by the flattening of the curve on the right-hand side of the graph. And again, I want to encourage persons who have not yet been vaccinated to either register or walk into one of our vaccine clinics. So with that being said, I wanted to let you know where you can get your vaccine. So currently we have 2 vaccine administration locations, or VALs, which are the CPS Vineyard Building here in Phillipsburg or the Bel Air Community Center. And so one thing that I wanted to highlight for the viewers and listeners is that on Tuesdays and Thursdays at the Bel Air Community Center, we have extended our hours until 8 p.m. This is to allow for persons who are not available during the traditional 8 to 5 workday. And we look forward to hearing your feedback about this evening clinic. It's important for us to constantly adapt our strategy. And so this was one initiative that we decided as VMT to execute to allow persons to access the location and to get vaccinated after hours. In my last slide before I hand it over to Dr. Deitz, I wanted to mention that, over the past few weeks, the VMT has adapted our strategy, and now we are bringing vaccines to the community. And what we have done over the last 3 weeks is hosted various pop-up vaccination clinics, which we've received tremendous feedback. And so this for us was reassuring to let us know that we needed to continue to be out into the community. So we held a very successful launch here at CPS, which was held on a Saturday back in April. And we followed up with that later on this past weekend in the Belvedere community. And moving forward, we haven't forgotten those persons over the hill. So we will be planning is already underway to be able to reach the Cold Bay residents. So we will be coming forward on May 22nd to your neighborhood to be available for vaccinations and to answer any questions that you may have. Another is that over the course of the last 2 to 3 months, we've had various information sessions by members of the vaccination team. And so I want to continue to encourage, whether it's a business, small or large, if you have persons in your establishment that are a bit hesitant about getting the vaccine, have some questions or concerns, we can definitely make ourselves available to you and your organization. And I ask that you either call 914 or email Bart. His email is on the screen here at White and Yellow Cross, or you can also email vaccination@stmartingov.org to request an information session. In closing, I would like to thank all of the teams involved in helping to make this campaign a success. As I, like to tell my team, collectively, we can do more and get further. So I want to acknowledge at the Bel Air and at the CPS offices who have given their time. Community, and as the minister said, get closer to the 95 drive. And I want to encourage persons again to come forward to get vaccinated, to come out. Any questions or concerns, again, do not hesitate to call 914. And I thank you for this opportunity. And with that, I would like to hand it over to my colleague, Dr. Deitz, who will.
Well, thank you. present and give some information on the vaccine and be part of this, what I already call a very nice and important movement to get sufficient persons vaccinated and to deal in a very effective way with this virus. So just starting with COVID-19, when you look at the virus, and I'll give some general remarks and some helicopter view, and also give at the end some very exciting results we've been receiving with the use of vaccine in the real world. So very briefly on SARS-CoV-2 virus, it is an infectious respiratory disease. Most of the symptoms are, like we all already know, some fever, some cough, and 80% of the infectivity results in mild symptoms. You can get some shortness of breath, and in 20%, 15 to 20% of the cases, this will result in you going to the hospital if you are not treated at the moment or are not vaccinated. So important again to realize, how do you get contaminated? Well, that's through aerosol and through coughing or sneezing by an infected person, by shaking hands, kissing or hugging, by touching a surface on which droplets have fallen or being touched by an infected person. 80% of the persons, as we already said, doesn't stay home while having symptoms. So we need to take that into account. Again, look at those 5 informative figures and keep on doing that, because of the fact that we still need to take these measures into account in relationship to combating the virus, because, as we say, it's a 1-2 punch. So it's on the one hand side, it's your vaccine, but on the other hand side, it's all those public health measures we're taking in order to keep this virus at bay. Can I have the next slide, please? So going very briefly on the history of vaccines, we need to realize that it's nothing new. Vaccines are the most effective medical intervention that we know. It started at the turn of the 19th century. We've been using vaccines. The only thing we're doing right now is we are making use of this vehicle that saves 2 to 3 million lives per year. And we have already shown that vaccines with other diseases like polio have eradicated those diseases from existence. As you can see there in the graph to the right-hand side, we've introduced vaccination for polio in the 50s and 60s. And as you can see, it almost immediately worked, and it eradicated the virus from existence, and polio is not a threatening disease anymore. Can I have the next slide, please? So what does a vaccine do? Well, actually, a vaccine simulates an infection in a very effective way, and it stimulates your immune system. And it simulates that immune system in such a way that it can remember the virus without becoming sick. So what you do is you stimulate, without becoming sick, you stimulate the immune system with a vaccine. It's actually a harmless piece of virus. You don't get sick, but you get that immune response. So you have your antibodies ready, you have your immune system ready in order to combat the virus the moment you see the virus or the virus tries to infect you. And that's in a natural way. So what we have here is a medical intervention that's very well controlled, that's very safe, that brings about the immune response you want to have, that brings about the defense you want to have in order for you to combat the virus and keep the virus at bay. Next slide, please. What kind of virus are you using in St. Martin? Is one of the most effective vaccines we know. And in St. Martin is using right now a messenger RNA vaccine from Pfizer. And what's the messenger RNA? A messenger RNA is just the small genetic information, the blueprint of the virus. And for this vaccine, we're taking just a small bit of that genetic information or that blueprint, put it in a lipid liposome and in a lipid sphere. That lipid sphere contains a little bit of water, a little bit of that genetic information, comes into your body after injection and takes over some cells, and you start making parts of the virus. So not the whole virus, just parts of the virus. By making those parts of the virus, your immune system starts to react, and having 2 shots, after 2 shots, so we start with a primer, we go to the booster. After the booster, the second shot, your immune system is completely aware of the virus, is completely prepared for the virus. You have antibodies you're producing, and those antibodies are over there and I'm present the moment the virus tries to infect you. If you look at the safety, these vaccines have been extensively tested and also went through a very rigid system of quality control, for instance, by international regulatory agencies like the FDA in the United States and EMA in Europe, before being used on a global scale, before being used, for instance, in St. Martin. So the technology, again, is not new. The messenger RNA technology has been used already for more than 10 years in treating cancer patients. And as I said, which is very important, two things. You do not get the virus. You cannot get COVID-19 from the vaccine because it doesn't contain the virus. And there's another fable going around that it can change your DNA, which is absolutely not the case because it's another language of genetic information. So that is not the case. May I have the next slide, please? Okay, so why is vaccination important? Well, there are two reasons. First of all, for yourself, in the sense that you do not want to become sick. Secondly, we are now realizing it's not only the acute SARS-CoV-2 infection, so that's the virus that gives results in COVID-19, but it's what we're now seeing with developing in time. We're also seeing that persons that got infected at a certain moment in time still have what we call long-term COVID. That means that 3, 4, 5 months after you passed through your primary infection, you became sick, and then the virus abated, so you don't have infection. These persons infected have what we call long-term COVID. They still respiratory tracts or their lungs, they still have cognitive problems. The vaccine protects you again, realizing again it's not only on short term but also on long term. And next to that, and it's very important, of becoming infected. Protected persons that are vulnerable, old age, having diabetes, obese, percentage of the population being vaccinated and protected, the anymore in your society or community, therefore eliminated. And at this moment in time, we think that of 85% of the population, that's what we call the herd immunity. If we reach that 85%, we think that the virus will not be able to replicate anymore in your community and be effectively eliminated. Next slide, please. So when we use the vaccine, what are the side effects you can expect? Well, first of all, the side effects, maybe if you've been vaccinated for other infectious diseases, you know them already, is the fact that having a side effect, having these side effects is actually a good thing, because you get some mild pain at the point of injection, you get some tiredness, you get headaches, you can get some fever or nausea. That's a good indication because of the fact that your body is responding, your immune system is responding. And those side effects will abate, will go away in about 2 to 3 days. The vaccine itself will be completely broken down within 72 hours, and the genetic information will disappear in a couple of hours. So it is not a drug that will remain in your body. It's something that will give you what will remain in your body is something very natural. It's your own protective immune system. The vaccine itself, the formulation itself, will disappear in a couple of hours, and with that, having you will have a very active immune system ready to go to combat the virus. May I have the next slide, please? So now, what are the results we are seeing all over the world with the use of vaccines, and in this case, the Pfizer vaccine, or the BioNTech, or Comirnaty as we call it? We've reached about 1.3 billion doses vaccines administered. Over 245 million doses have been given in the United States, for example, from December 14th through May the 3rd. So we have very good information on how well this virus is functioning in real time. Next slide, please. And what we're seeing is almost spectacular. And these are results we are seeing in one of the countries that started in December with a very active vaccination program, and that is Israel, reaching at this moment in time about 70% of their population being vaccinated. And what they see is that the vaccine is 95% effective. So a very high degree of protection for the country. And what that means is that with this type of protection, the country is opening up. Israel is now opening up because of the fact that this vaccine is working spectacularly. And this is something, of course, we all want, and we all want also in St. Martin, because of the fact that if you have that high effectivity and that high percentage of coverage, then the virus is not able to keep on infecting persons in your country, and you can open up, and then you can have your economy running up again, etc. But from a medical perspective, it's very effective. What we're now seeing also, and you've read that, and you've maybe seen that on television, there are a couple of variants or mutants that are also present. And what we're seeing, for instance, with figures in Israel, but also in other countries like Qatar, where they looked at about 270,000 persons, mind you, the protective effect of the vaccine was 90% for the British variant, which we also have in the Caribbean and also in St. Martin. And what we see is that there's also a high degree of protection against the South African variant. So also with the new mutants coming up, real-time data of countries already having a very high percentage of coverage are showing extremely very positive effects and being a very effective vaccine. So in that sense, what you have in St. Martin is the best of the best. So making good use of it because of the fact that you want to reach that percentage coverage in order to have that vaccine as effective as possible. Next slide, please. Can I have the next slide, please?
Yes, sorry. This is the end of my slides, but let me...
Then we can go to the next section of the presentations, right?
Yes.
Here we go.
Great. So yes, that was it for me, and I believe it for Dr. We can now open the floor for questions, or you let me know.
Thank you so much, Mrs. Lucida Weaver and Dr. Deitz for the presentation. If you've just joined us, you are watching the second for today, Tuesday, May 11th, 2021. Thank you for joining us. We now move on to the question and answer session, and I would also like to encourage to our Facebook Live. The questions which will be answered right now are questions that were received ahead of time via the email address. The first question, I will direct it, if he is available, is Dr. Rago Singh, General Practitioner on St. Martin. Why do I need the PCR test after vaccination? If Dr. Rago Singh is unavailable, maybe Dr. Deitz can chime in.
Do you hear me well?
Yes, Dr. Rago Singh, we can hear you.
Hi,
Thank
good
you.
evening. Hi, the reason why you need a PCR test after vaccination is because the vaccination protects you, but it doesn't protect others. So the PCR test is required for going to travel. Most countries request you to come in with a negative PCR test because they want to make sure that you are. Main reason why they request a PCR test from you. So it's although you are vaccinated, you can still have the virus, and you can still spread the virus. As far as we know at this moment, there is continuous investigations going on. There are continuous investigations going on. But because of that reason, the PCR test has been requested up till now, and we don't know if that will change in the near future.
Thank you, Dr. Agustin. Second question, does the vaccine hurt? This is for Nurse Claudette.
Good evening, everyone. Oftentimes, I receive these and they are fearful. They always ask if the vaccine hurt. I always use my own experience to explain to the person. So I will explain them that the vaccine feel in my light pinched, but at the end of the day, you have to bear it situation in a different way. So and you can be the judge. So after the vaccination, I will explain, it's not so bad. I could have taken another one.
Thank you, Nurse Claudette. If I can still get sick. This is for Dr. Dice.
Sorry, could you repeat the question? I had a
question is, what is the significance of the vaccination if I can still get sick?
Okay, well, what we're seeing right now is the fact that just are those figures that we mentioned from Israel. What could still become sick, right? Now, what we're showing right now, and those are new figures, these are publications of 2 weeks ago, the vaccine is as effective as 95% or carrying the virus is extremely low. So with ongoing knowledge and developments, it'll probably result in what was said beforehand, that being affected, and that's what we know right now. It seems like they know, and that would mean on the or months that what is going to be required is your passport, to have a formal vaccination passport, which shows that you've been vaccinated with the Pfizer vaccine, for instance, and that Europe is busy with that at this moment in time. So you're going to have two options while traveling, probably. Or if you're vaccinated, the passport. So in having more people vaccinated, because if you reach that, and probably will not be necessary. Again, those are developments that are going on right now.
Thank you, Dr. Dietz. Our next question, why can children not get vaccinated?
Can you repeat?
Why?
First of all, the children, it was not that. And the second reason was that children were statistically not getting that ill. The percent getting infected and ill was much lower than the adult population. So in the meantime, there have been more studies done. And nowadays, there is an approval for 16 on its way to get approved, to get, it was saying, there are new developments going on all the time. The FDA 12 to 16 as well to receive the vaccination. We are not that far. We are waiting on guidelines. We have to wait until we reach to that state. They reach to that stage and make that decision. But at the moment, studies are going on, and it seems that it can be used in kids who are younger now as well. So these are continuous conclusions from continuous studies that are coming in, and adjustments that are on their way all the time.
Vaccine is developed so quick? Dr. Dye?
Well, there are a couple of things. The technique has developed tremendously in the last years. Related virus, which was called the SARS, as you can remember, in 2001. So we got a lot outbreak, and the MERS outbreak in 2010 in Saudi Arabia. Next to that, the Pfizer vaccine is a new one that makes. But next to that, also very important, it was the first time in ages that a pandemic was such a big problem for the developed world, for the Western world. So you developing the vaccines, and that brought about that something 10 years now could be developed with the same measure of safety, with the time. Actually, just to finalize, we need to be a little bit critical on why the other vaccines were not developed in a year's time. Why would they take 5 years' time? So it's in a medical perspective, there was a very high urge on developing the vaccine, but nevertheless, we need to respect the fact that those vaccines go through a different, and they have to be approved by regulatory bodies like EMA in Europe, like the FDA in the United States. Even been approved when see something happening. AstraZeneca, as we've seen with Johnson & Johnson. So it's an ongoing process. Products that are on the market right now. And again, going back to the Pfizer we're using, it's a tremendous vaccine. Very important. So we have the best of the best for St. Martin at this moment.
Following, does AstraZeneca or the Janssen?
High, there's a risk of blood clots, which have been described. In the general population, there are discussions, but you need to compare that to stepping into an airplane. If you fly from St. Martin to the Netherlands, it's 100 times higher of getting those clotting problems. But in comparison to Pfizer, there is a higher risk of having complications, which is 1 in 100 or 1 in 500,000 persons being vaccinated. But the risk exists.
Following question is for Ava. The target number of how many people we need to vaccinate keeps changing. What is the number, and is it still 70 or the 85%?
Thanks for that question, Relika. The 70 or 80 or 85% is a level where the virus can't replicate. And for this target, or for this,
can I still spread the virus if I'm vaccinated?
At the moment, we think that you're still. We need to have the mouthpiece still on, although you're fully vaccinated, because there are others spread the virus to those. So that is, as far as I know at this moment, the reality. Dr. Duits, do you want to elaborate a bit on this? Maybe?
Yeah, I think yes. Thanks again. What you're saying, Doctor, is completely according to what let's say the conventional what we had up until last month. Let's put it very frankly like that. Again, figures the protection of 95%, for asymptomatics 90%. So what we're seeing is not only persons are not becoming sick, because that was the first outcome, and for not becoming sick, there was a hesitancy in saying, well, you know what, the viral load, you can still have a little. Certainly say that with use of the Pfizer vaccine, and those are the figures I showed you, there is a high degree of protection and a high degree of not being infective anymore. So we're in the midst of a transition of being very reserved in order to have all the public health measurements in to a more relaxed approach, because of the fact that now we're learning that this vaccine is so effective. So you have a very low chance after being vaccinated become infected. Your viral load is very low, and that translates to the chance that you can infect. But again, we still need to keep that 1-2 punch, because not all of go around walking because you did or not. So this is what we would like to see. Is the vaccine is so effective that at the end of the day, and I will tell you, it'll be in a couple of weeks' time, the new guidelines will come out, and they will tell you, well, you know what, if you've been effectively vaccinated, and remember, let's just put one other thing into perspective. Different things. The moment you get vaccinated, you're not protected. Your first shot, it's 14 days that the vaccine gets up and running, your immune system. After the second shot, so the primer, it takes minimally 7 days for you to be completely protected. So, and that's when the protection starts. So it doesn't start the moment you get vaccinated. But again, that with these vaccines, your chance of infecting somebody else is extremely low.
All right,
Moving
that's the
along, the
reason
next
why
question.
I asked you, Dr. Deutsch, to elaborate on this, because the RFEM is still saying going to change. That's
Yes.
why this is a very interesting question, I think.
Yeah, it's
Thank you.
like it's going on. It's real. It's real. There's something new coming in.
When I'm vaccinated?
Yes, you can. As well, but I think some persons who are tuning in are very well aware that requirements for persons who are fully vaccinated within the U.S. wearing your mask, keeping your distance. And as Dr. Deutsch mentioned as well, currently the EU has launched this policy initiative. So I think it's fair to say that vaccinations and travel will become. I can say is that as the department sort of responsible for with vaccination records, we international practices. This digital green certificate, we are Kingdom partners to make sure
What do you do when people are
feel comfortable? I try to find out what they are. Sometimes I have to get another colleague to be there to give support. Like I would ask, you need somebody to hold your hand, or I give them the time to talk, and then I will wait for them to vaccinated. The vaccination sometimes pull away. So we need to engage in more. So you give that emotional support, and when they are ready, then they will say, nurse, I'm ready for the vaccination.
How come there are different strains, and how many, and how are they?
Well, what happens is something which is very, and a virus replicates in such a sense that it doesn't control the outcome of its replication in a very strict way. So you get what you get variants have at a certain moment in time, some of these are viruses that from a certain perspective, we call them a variant of concern, of a variant. They get a new, more adapted form to infect the cells. So that's why viruses become mutated and you get variants. And so that's why it's very important to eliminate the replication of the virus in different persons, because the longer the virus replicates, the more chance you have of getting variants, and the more chance you get, which happened, for instance, in Great Britain, which we also have over here in the Caribbean, what happens in Brazil, which happens in South Africa. So how do you effectively remove that? By cannot replicate. So that's a very normal pattern of a virus. So the longer the virus circulates in your community, the higher mutant virus, a variant emerges that's more effective, and those viruses we do not want. So that's the way viruses work.
Next question directed towards Ava. Why are we getting the Pfizer vaccine and not the others?
Thanks, Relika. Because what we've seen and what Dr. Deutz has mentioned time and I will always remember in the first panel that we had, Dr. to say that we are extremely privileged as an island on a whole, free of charge. And so with that, you know, because we don't know how long it will be available. There are countries where persons are still waiting. Quite a bit of supply to ensure that, you know, all of our population can receive it. You know, the future, we don't know what the future holds. We could have other vaccines available to us, but at this moment in time, we have continued to performed when you compare it to the other vaccines currently out there.
Why did they stop using supposed to be safe? And also,
Well, yeah, well, let's start with AstraZeneca first. With vaccines, with any other drugs, you talk about risks. So several countries to low platelet counts and being hypercoagulated. Possibilities. They have either the possibility of using messenger RNA vaccines, so making use of a good vaccine, which is AstraZeneca, but with a slightly higher risk of complications. Looking at that, countries like Norway and Denmark have said, well, you know what? message RNA from Pfizer. We will make that because of a slightly higher risk of complications, which in an absolute sense is very low. But again, the country decides on the availability of vaccines. So that's what happened with AstraZeneca. And now if you use AstraZeneca, it is required by the producer to put on a label, the same you have with paracetamol or other drugs you're taking, what are the side effects you can expect, and that's for AstraZeneca. What happened with Johnson & Johnson is actually the same. They stopped the use of Johnson & Johnson in the United States briefly because they also saw with Johnson & Johnson that there were some complications related to hypercoagulability. And they again said to Johnson & Johnson, you need to put in your use of Johnson & Johnson could have a slightly higher complicating effect. So there are slightly higher risks, but if you have the choice, what's happening? They're both good vaccines, Johnson & Johnson and AstraZeneca, but between us, Pfizer is better. So that's...
Once again, for you, Dr. Darts, what happens if I take the vaccine while I have the corona and I don't realize it?
Nothing's going to happen. The moment you have, if you have the vaccine, the only thing that will happen is that the immune system will be boosted by both the virus and the vaccine. Any combination, it'll give you the best defense you can have. So don't worry about that.
A next question for you. Reach herd immunity if you are not vaccinating under 18 years?
That's a very critical and good question. And I like those questions because you see that the persons are listening and the persons are very... And to get also the young people and children and adolescents vaccinated. But you have to do in the Dutch Caribbean and in St. Martin is trying to do is getting to a... He said the moment the vaccines get a formal approval from RIVM for use for adolescents, so between 12 to 15, and then between 0 to 12, those can be herd immunity you want. So we're starting already. The results are coming in. Pfizer already got approved in the United States for adolescents, so between 12 to 15, and we expect in August and September. Then we will have, if you're already at the 60-70% with your population, then it's a very small step in getting all the other ones.
Next question for Dr. Rago Singh. Can you take the vaccine when you are breastfeeding?
That's an interesting question as well. And there is another development in that regards as well. The advice that if you are pregnant, you are not allowed to take the vaccination. Well, that's about to change. There are new developments going on, and pretty soon there will be recommendations that pregnant women are allowed to take the vaccination as well. And this is just because it has been tested now on pregnant women, and there has not been any proof of any adverse reactions as at the moment. So yes, you can be lactating and you can be breastfeeding and take the vaccination. And yes, there are developments in that regards regarding pregnant women coming on pretty soon as well. Thank you.
Following question for Dr. Darts. The CEO of Pfizer said that a third...
We are looking at those figures right now with the mutants, and we still need to do some work regarding... With long term, I mean, how long will you be protected against the virus? And on a regular basis, like the flu vaccine, maybe once every 2 years, another shot. We're not quite sure yet. The possibilities the CEO of Pfizer mentioned in one of the interviews, that could be a possibility. So it's something that we need to address. We are the latest results in order to give a definite answer on if you need to be revaccinated and what.
Following the question once again for you, Dr.
Yes, of course, we hope for a long-term side effect. That is your immune protection. That's the long-term side effect we need to have. That's what we want. As I explained already, for no vaccines all over in your body is your own immune system. So that's the long-term effect we strive for. There's no information on any other vaccines we've used that long-term effect expecting from any perspective to see any other long-term effects than the.
This is now the last question that we've received ahead of time to Nurse Claudette. Island, the vaccine.
To be the first, because I had a aim COVID clients here in my department, and I've seen her obtaining the COVID virus. So my clients and vulnerable people around me. So that was my driving stone for taking the vaccine. Get your comfortable place. Of course, there is no fear.
For answering.
2 to 3 million lives every year. Intervention spread. When enough people are vaccinated to create herd immunity, the government tourists can return, which is vital for our economy. The COVID-19 vaccine should take the vaccine, but it is highly situation. Discuss them with your doctor. In the meantime, we must be responsible and keep practicing like wearing your mask. This public service announcement Preventive Services and the Department of Communication.
All persons, even those who have received a COVID-19 vaccine, must continue to maintain physical distance, wear a mask to protect themselves and their communities, and thoroughly wash their hands. Patience is key and commitment is essential. The ability to keep each other safe and healthy is literally in our hands.
Hi, I took the vaccine.
I took the vaccine.
I took the vaccine.
I took the vaccine.
I
took the vaccine.
Oui, j'ai pris le vaccin.
I took the vaccine. Moi, pris le vaccin. I
do.
So those are the news.
You're watching the Ministry of Public Health, Social Development and Labor's second panel discussion on the COVID-19 vaccination updates and developments.
Welcome to the COVID-19 vaccine on St. Martin. We will now go to the questions which were retrieved via the Facebook live feed. The first question is for Ava. Why is CPS test for antibodies antigens test not valid for travel?
So currently, CPS, if a person comes to the drive-through and want to know their COVID status, whether they are in contact with someone who has recently had COVID or if they are themselves feeling symptomatic, we do an antigen test or a PCR. But as I mentioned, we do not do travel testing. So if have to ensure that this is done through the local labs on the Dutch side of the island. So this is either at SLS or HCLS. And depending on where you are traveling, the country where you're traveling might request either a PCR or an antigen test. So again, CPS does not do travel testing, nor do we do any antibody testing at this moment.
Next question, once again for you, Ava. When will the vaccine passport be available for St. Martin? Can we use the RIVM card in the meantime?
Yes, so I don't have a concrete, definitive answer. We have started. So I'm hoping in the next few weeks we will have updated information, which will of course be disseminated timely. In the interim, yes, you can use the vaccine card that you would have received either at Bel Air or CPS, White and Yellow Cross, or SMMC, depending on where you received your vaccine. But it is a blue, white, and yellow card, and I believe it says on the top from the Ministry of Welfare and Sport. Persons to take care of that piece of paper because if a country does require any proof of vaccination, or if you are if you need it for whatever reason for school, you will be asked to present that. So we want to ensure that persons are taking care of that because this is the proof that you have been fully vaccinated against COVID-19.
Thank you, Ava. Next question for Dr. Dice. What is your view on the ribosomes misprinting? The ribosomes, yeah.
The ribosome misprinting. To the fact that by producing your proteins, you need to go through the ribosome. So that's an organelle in a cell, which is something very technical. So in regards of that, misprinting is one of the facts that the virus does. The virus replicates without a very good system of looking at what the product is. And so that's normal. That's not any virus. What we know from this virus is that it's very vulnerable for mutations, and that's safe for variants. So we need to keep that at bay.
Dr. Dice, following question is, I think, 12 months because of variants. Does this mean herd immunity of the population getting vaccinated each and every year? Still around 100 years later, and there is a vaccine.
We are not quite sure at this moment in that we need to eliminate the virus. And what we really know in comparison to influenza, we know that this virus is different in the sense that what we're focusing on is a what we call as the part of influenza that makes it necessary for every year to do some agglutinin protein, and that changes extremely SARS-CoV-2. So what we're hoping for, that part of the herd immunity will still be holding true after a couple of shots of vaccination. I'm sorry.
Following question for Ava. If St. Martin doesn't get herd immunity, then what?
I mean, I guess to elaborate on what Dr. Deitz mentioned earlier, obviously you want to reach herd immunity so that the virus isn't replicating and you are protecting your vulnerable population, so those that might not be able to receive the vaccine for whatever reason. So, you know, it's not to say that to get to a level where we are confident enough that but needless to say is that the virus will be around, and we'll just have to push forward. I think we will also have to continue the measures that we have in place. So it's your hand washing, the mask wearing, the keeping your distance. So the quicker we get to that goal, to reality or life pre-COVID.
Maybe I can add a little bit from experience on that. You would then expect to have blips. So that means that you will have days that you don't have any problems with the virus, and then suddenly at something, you see a blip, you see an increment, then you need to take all your, not letting it become something which is, so you, as a country, you become vulnerable for those blips. And that's very, very difficult to every time go from a very relaxed situation to a situation where you need to take public health measures again. So I think people should realize that, and realize that by not reaching that, this will be a test case every day.
Following question once again for you, Dr. Deitz. If you have antibodies, why take the vaccine, especially since it's supposed to be known that being vaccinated after having had COVID gives a bigger chance of having serious adverse reaction as compared to those?
That's not true. There's no data, scientific data showing that. What is true, and what we know from scientific data, is something which is, again, holds true for the messenger RNA vaccines. What we're seeing right now is when you get vaccinated, you get even better protection than when you get the natural infection. That's what we're seeing. We are seeing persons that have been infected, looking at their immune system, their antibodies, and comparing those to persons that have been fully vaccinated. We see those persons fully vaccinated much better protected. So that's why there's a lot of information and data saying that even though you went through an infection, you still need to get vaccinated, because that's the only way to get the highest protection we can get. And with the messenger RNA vaccines, we're seeing that right now. So again, through science, through data, to publications, we can definitely say, go for the vaccine, because that's, regardless of your history of being vaccinated, you get the highest protection. And there is zero information, zero data, zero scientific proof that it can be deleterious to your health after you've been infected.
Next question, Dr. Deitz, maybe you can answer this one. Can a person with cancer and taking chemotherapy still take the vaccine?
Yes. The persons who are under chemotherapy, or depending, they need to discuss this at the moment in time with their oncologist. Maybe there's a situation where you would like to postpone the treatment and getting the vaccine. Why is that? There's one example. You get some treatments for cancer, you can have a fever, or you can feel fatigue, or you cannot feel well. The doctor would like to know that, because those are symptoms you can also get from being vaccinated. So for your, he would like to know if you get those symptoms, that they're coming from either the vaccination or they're coming as a side effect of the treatment. Into account. So in a general sense, you can take the vaccine, but for a very specific, just discuss it with an issue. If it's an issue, it'll probably be an issue in regarding what type of treatment you're getting, and if you could wait with the treatment and get the vaccination.
Okay, final question coming in from the live Facebook feed. Can I take the vaccine when I have Bell's palsy?
Oh yes, no, there's no contraindication for getting a vaccine if you have Bell's palsy. None at all.
Okay. The question and answer session. If there are any further questions that the public may have, those can be sent in writing to vaccination@stmartingov.org. I would now like to invite the Minister of Public Health, Social Development and Labor, the Honorable Omar Otley, to give us his closing message. Minister Otley, you have the floor.
Thank you, Rolika. I would like to thank fruitful panel. I thank all of the questions posed via social media and those that sent it previously to the panel. You guys were very descriptive, very detailed, and a lot of things I myself, as Minister of Public Health, learned tonight. I thank you very much, and I look forward to the next panel.
Honorable Minister of Public Health, Social Development and Labor, the Honorable Omar Otley, Epidemiologist and Head of CPS, Evalista De Weaver, Nurse Claudette Reif, Dr. Anand Raghu and Professor Dr. Ashley Dites, radio listeners and online viewers, this brings us to the end of the second live panel discussion for today, Tuesday, May 11, 2021. For rebroadcast, tune into St. Martin Gov Radio 107.9 FM, the official Facebook page of the Government of St. Martin, the YouTube channel Government of St. Martin, and St. Martin Cable TV channel 11 to the YouTube channel Government of St. Martin. On behalf of the Government of St. Martin, I'm Rolika Roach and wishing you a pleasant evening further.